So this photo of my cousins Frankie and Peter was taken in 1977, before I was born. Frankie and Peter were born 2 years apart, and they were both born with a hole in their heart, a relatively common form of congenital heart disease. As Peter grew older, fortunately the hole in his heart closed and healed, and he has gone on to live a full, healthy and active life. Sadly, his brother Frankie passed away at the age of 9, and his heart disease has really been the inspiration for my own career in medical research. Fast forward to 2018, and congenital heart disease remains the most common birth abnormality in children. It affects up to 1 in 100 live births. And despite remarkable advances in the treatment of congenital heart disease, it's still the leading cause of infant death. It claims the lives of more children under the age of 1 than any other condition. And for survivors of congenital heart disease, the story doesn't end there. These are often complex chronic diseases requiring lifelong treatment. These are clearly alarming statistics, and we need to do more. And there's a need for radical, transformative and new approaches to change the life course trajectory of children affected by heart disease. Our laboratory is trying to harness stem cells to repair the hearts of children affected by heart disease. It's now possible to take skin cells, blood or even a urine sample and to turn those cells into a type of stem cell known as an induced pluripotent stem cell, or iPSC. And these stem cells have the potential to form all of the cell types in the body. Our lab has developed methods that allow us to turn these stem cells into heart tissue. And we can grow this heart tissue in a laboratory dish where it beats away in much the same way as the heart in your chest is pumping away right now. So we are now interested in using this technology and moving it forward towards potential therapies for children with heart disease. And we've brought together a team of stem cell scientists, cardiologists, cardiac surgeons and bioengineers from the Melbourne Children's Campus and from around the country to try and work towards this goal. And the condition that we're focusing on is a rare but severe and very complex form of congenital heart disease known as hyperplastic left heart syndrome, or HLHS. And this condition is characterised by severe underdevelopment of the entire left side of the heart. These children are essentially born with half a heart. Left untreated, this condition is universally lethal. However, thanks to advances in the surgical management of these patients over the last 20 to 30 years, children with HLHS are now surviving into adulthood. And this is due to multiple surgeries during early childhood which allow the heart to function with a single ventricle or pumping chamber. However, ultimately this single ventricle fails, usually during early adulthood, and this condition is also associated with a number of other complications that severely compromise the patient's quality of life. And so we're trying to create an artificial pump derived from the patient's own stem cells that would help to support the circulation and prevent the heart from failing in children with single ventricle defects. If successful, this approach would usher in an era of personalised regenerative medicine which could radically transform the life course trajectory of children with some of the most severe and complex forms of congenital heart disease. So 40 years since this photo was taken, we have seen remarkable advances in the treatment of congenital heart disease, but clearly there is still a long way to go. And stem cell medicine really offers hope that we may be able to develop new, creative and innovative solutions to radically transform the lives of children affected by heart disease. And our goal is really to turn that dream into a reality. Thank you.